Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom on the program this evening. It's something a lot of viewers have an interest in fact, people across the country, and for good reason. In a major development for India's fight against diabetes and obesity, Novo Nordisk, that's a Danish company, has launched Ozempic. It's a semi-glutide injection. This is being launched across India now. It's a rate across the world. Now, this once-weekly therapy, globally acclaimed for managing type 2 diabetes and driving significant weight loss, arrives as India grapples with over 100 million diabetes cases and 250 million cases of obese adults. However, Ozempic's rise has sparked debate over its use as a lifestyle drug. Critics argue that its weight loss appeal fuels vanity-driven demand among non-diabetic users, raising ethical concerns about prioritizing aesthetics over medical need. Supporters counter that its benefit for obesity, which is a serious health condition, justifies broader use. Now, with patents expiring in March next year, generics from, for example, Dr. Reddy's or Natco could lower prices, though pricing itself remains undisclosed. Now, experts praise Ozempic's cardiovascular and kidney benefits, but caution about side effects such as nausea, among others. On the show tonight, Ozempic is in India. Is this a weight loss craze, potentially, or is it a medical marvel? Before that, I think a lot of people want to know the cost of this. And remember, there are alternatives in the market which are available as well. So the current market rate snapshot prices obviously vary by brand, dose, and the format, whether it's a vial or a pen. Pen is used in the case of Ozempic. The drugs that are on the markets right now, apart from Ozempic, Wegovy and Mounjaro, these are called GLP-1 class drugs. This is the class of drugs which is really a revolution. The retail prices obviously fluctuate, and there are reasons for this. They fluctuate from city to city. There are other reasons as well why they fluctuate. Let's bring out the other reasons why they fluctuate. The dose and the pack of the size is a factor. Now, if you look at prices, presently Wegovy, which is marketed, comes out about 17,000 rupees per month, 17,345 to 26,015. That's the range of Wegovy. Let's look at the other one. Mounjaro is presently between 4,000 to 17,500 rupees per month, so a huge variation over there. The question on Ozempic, now this is based on imports, it's an unofficial number. It comes in at about 20,000 rupees per pen, is the sense. And so that's something that we're going to be looking at the prices. But again, the key issue over here is how much will these prices come down once they become generic. These are all branded. So in terms of the dose and the pack size, that obviously influences the price. There's a difference in prices between when it is dispensed or given to patients in a hospital versus at a retail pharmacy. There is a difference between the price of the drug in different cities of the country. If there is a bulk purchase or a government procurement, then obviously that has an impact on prices as well. And as I mentioned, it's going to be generic in the future, just next year, right? And therefore, that's going to drive costs down. So it all does sound to be a huge revolution. Is it that? And I think what we're going to focus on this program is in terms of the medical benefits over here and the potential threat. So I'm joined now by a couple of fantastic guests. Dr. Ambrish Mittal is the author of the book, The Weight Loss Revolution, and chairperson of endocrinology and diabetes at Max. Another Ambrish, Dr. Ambrish Satwik, is a vascular and endovascular surgeon at Sir Gangaram Hospital. We've got Mimamsa Singh Tomar, a clinical psychologist, and Ishi Khosla, a clinical nutritionist, columnist, and author. Dr. Ambrish Mittal, let me come to you first, sir. Is it your concern that this is a drug which might be misused? It's meant for a particular purpose. It has benefits on the side, but it's not or should not be a lifestyle drug.
I think the first thing is that this drug has immense uses, and I'm hoping it will be accessible to many more who actually need it, because it's this class of drugs is changing the way we manage diabetes and metabolic disorders. Like with every such drug, there is a great potential for misuse, particularly in the light of the fact that this has cosmetic implications and people think it's a great way to just lose weight and look better. Remember that misuse is something that has to be stopped by regulation or by awareness. That is something else. But the fact is that use is more important than misuse. In one line, I'll just say, give an example of corticosteroids. Steroids, as we all know them, are life-saving drugs, but they are grossly misused in India. That does not mean that they are not life-saving drugs. So just to give an analogy that people will understand. So yes, I am concerned about misuse because if people use them without medical supervision, without medical guidance, without proper prescriptions, certainly there is a potential for misuse. But if used properly, these are remarkable molecules.
Dr. Satwik, what are the medical challenges or potential side effects of Ozempic use?
So, I'm not an endocrinologist and I don't deal with the cause of obesity. I deal with the consequences of obesity. I deal with the kind of wreckage of obesity and the complications of obesity. But I am in complete agreement with Dr. Mittal when he says that this is really important for a large subset of patients. And I'll tell you why this is so important for someone with a BMI more than 30 or 35. It's because it's very, very difficult, almost impossible, for someone with a BMI above 35 to lose weight by lifestyle modification and calorific deficit and exercise. And then the reason is that the body and biology kind of sabotages any attempt at weight loss due to calorific deficit or due to exercise if your BMI is above 35. I mean, the brain has been hardwired in a sense that if you are trying to lose weight, the hypothalamus kind of perceives it as starvation, and it is trying to defend a set point of body fat, and therefore it's increasingly difficult for someone to lose weight meaningfully above, if your BMI is above 35, entirely by lifestyle modifications. And therefore, sometimes therapeutic pharmacological interventions are essential. And I think the question we should ask, obviously, would be the perceived side effects of obesity, but also about perceived side effects of these obesity treating drugs. But any solution is a kind of trade-off. And the side effects of obesity in terms of increased cardiovascular risk, increased stroke risk, increased risk of thrombosis, accelerated kidney damage, damage to joints, to the liver, to every conceivable organ are far, far more dreadful and guaranteed, and not just hypothetical, as opposed to some of the side effects that some individuals might experience.
Dr. Mittal, if you get onto something like Ozempic, and there is a positive impact in terms of weight loss, once you get off it, do you regain that weight really quickly?
Yes. Well, very quickly or not, but yes, you will regain the weight. No. So it's like treating any chronic disease. Now, Ozempic particularly, not Wegovy, the same molecule, semaglutide. Ozempic is marketed for diabetes. Now, when we take a medicine for diabetes, whether it's often oral or an injectable drug or insulin, very often it's for life. So there are certain conditions, chronic conditions, your blood pressure medication, you don't stop. So if you're taking medication for a chronic established condition, it's very likely to be for life. However, having said that, if you're using it just for weight, and that too you're not in the severely or morbidly obese category, it is very possible that sometime later in life, after a few years, you may try to taper off with the guidance of your doctor, either go on to a very low maintenance dose or maybe even go off it. But that will have to be seen as we go along. The truth is that any medicine that you take, except for things like antibiotics, when you go off the medicine, the condition comes back.
Yeah. Ishik Khosla, is there a real concern that the positive benefits of exercise and of self-regulation may end up disappearing if we are flooded by generic versions of Ozempic and the other drugs, which would become much, much cheaper. And therefore you eat what you want, you pop a tablet or you get a once a week Ozempic, and it's a quick fix solution. And therefore the benefits of regulating oneself or of exercise, right, might just disappear.
Well, it sounds like a pipe dream. And I'm sure many people do believe that it is something like eat what you want. But at the end of the day, we have to work with the principle of medicine, which is do no harm. And if we have solutions within our area of lifestyle management, I would first definitely look at addressing those. And the endocrinologist and Dr. Amrish Sathwik just mentioned that, the ultimate thing about calorie counting is not seemingly working beyond a certain BMI, but there are reasons for that. And the reasons, if they are understood today, they are understood far better than they were way back when we were students and in early days. Mm-hmm. And what I'm referring to is that calorie counting alone is not going to cut it, and that we know. And the crisis of obesity is only worsening to become grave and grave across the globe. So what is really, the answer, the solution seems to be lying in what we are now talking about, the gut microbiome. And if we have tools to fix that, I would use that as a far less toxic or harmful, fraught with risks kind of a situation, a therapy. So I would look at, that science is very clear and it's growing so rapidly. And, we have now data to suggest that if you just what we call microbial transplantation, if I transplant the microbial flora of an obese person to a lean person and vice versa, it changes the profile of the person. The lean becomes obese and the obese becomes lean. And so there is a population of certain bacteriotides and permucutides. These are the names of them. This is very complex. I don't want to oversimplify it. But the fact is that we do have answers lying in the gut, which tell us that this is about inflammation, and inflammation is largely caused by our food. So if we have the right tools, which are not going to harm us, I would go for that for clearly, reasons which we've discussed. All those side effects are known, and long-term safety trials beyond 2 to 3 years, RCTs have not been done on this drug. So whether is it okay for long-term, lifelong, etc., we don't know. There are early days. The fact is that even in few doses, it has killed people. And there are reports which have been published, and 82 deaths also have been reported published in British Medical Journal in the February issue, since it was, introduced in the UK. Yep. So there are issues. And so I would really look at a different picture. And yes, there would be situations where Dr. Mittal and myself, we all see where there is morbid obesity. We know lifestyle changes are not helping. So if that is the situation, like he rightly said, if there are steroid-like requirements, then we have to use it, but then it has to be monitored very carefully under the supervision of qualified professionals. Clearly, it's not just for cosmetics.
Mimamsa, is there a real concern that this is, to some people, a quick fix to, seeking a certain body type, and it's not the natural way to be lean? It's a drug at the end of the day. It has its side effects. We know a series of side effects: nausea, vomiting, diarrhea, constipation, fatigue, potential pancreatitis, gallbladder issues. These have all been listed. But if it's a quick fix solution for those who are desperate to have a certain body image, is there a certain danger?
So, I think we need to understand that in today's age and time where, different aspects of social media continue to reinforce a certain body type, and people do want to have a certain body type, it can certainly influence our decisions and choices in that sense. And in the aspect of where we need to understand the conformity part over here, where people do want to conform to having a lean body, and a quick fix solution to having that lean body, it certainly is going to impact the way they're going to look at this, where they may feel, and the influence of the decision in terms of the perceived immediate benefit may outweigh their ability to sort of think about other things as well. And like the other doctors have said that it's like any other over-the-counter drug. If not being taken with the help of the expert, yes, having that pressure to conform to have a certain body type, where the body image becomes more of a concern for an individual, brings in an aspect of self-confidence in them to have that body type. And in the age of social media, where the authentic self, we keep talking about it, but by just continuing to conform to having that body type, we do end up losing that sense of uniqueness and individuality of different body types that one can have. That certainly can have a psychological influence and impact in that way. And I think we need to really understand that aspect as well over here, that how do we sort of talk about and continue to work on that particular aspect as well, where we can sort of look at it in terms of the influence, because again it's about the lifestyle and what we are bombarded with all around us to have a desirable, favorable body type. It is going to have an impact, and it can certainly have an influence. And which is why it's very important to also look at, when we are talking about having a certain body type, we must also look at that, our self-confidence doesn't only come from having a certain body image, but, how the self also takes a hit, and how we continue to work on that in different levels, whether it's in schools and colleges, and it needs to continue to go on, because it's not just an immediate or just a one-time solution. We have to understand the long-term impact it's going to have, on young minds, on people, and otherwise, where a certain influence can just certainly impact their decision-making and choices.
Yeah. Dr. Satwik, who should not take Ozempic? Are there people with a certain medical condition who shouldn't be prescribed this?
Yeah, so I mean, yes, there are, but also I'd like to state that this is a drug. These are molecules that are specifically designed for pathological obesity more than 30 BMI, or 27 if you've got comorbid conditions. This isn't a drug for the sake of vanity. And obesity, morbid obesity in particular, isn't a benign, neutral lifestyle choice. It's not a condition like being left-handed. It produces enormous emotional and economic wreckage, not just in the individual, but also on the families. And therefore, a condition that has the potential of shortening lifespans and shattering families shouldn't be accepted or celebrated in any way, even if we're speaking of body positivity or body acceptance in that sense. To answer your specific question, there have been concerns raised in animal studies about certain cancers of the thyroid in animals that could be attributed to this molecule, and therefore patients who have a family history of medullary thyroid cancers or some other endocrine neoplasms will be well advised not to take it. In established cases of diabetic retinopathy, which is when a certain kind of blood vessels will proliferate in the retina, it should not be taken. Some caution should also be exercised in cases of glaucoma. And it has the potential in a certain subset of people to cause pancreatitis and gallstone disease. So, of course, and this is not an over-the-counter preparation, extreme scrupulousness will have to be, extreme care and caution will have to be exercised when this is being prescribed or administered. And I'd like to reiterate, this isn't for the sake of vanity. This is entirely for treating pathological morbidity. I mean, obesity is linked to an increased risk of 13 kinds of cancers.
Yes.
A common example that I give my patients is that something as elementary as osteoarthritis of the knees, bad knees, if someone's weighing 100 kilograms, if you take 20 kilograms off your body weight, it isn't 20 kilograms taken off the knees. The biomechanics of the gait are such that the the force, the weight, the dynamic force borne on the knees is 4 times the weight taken off. So if you're shedding 20 kilos of weight, you're taking 80 kilos off dynamic force off your knees. And if you're adding 20 kilos, you're adding 80 kilos of dynamic force to your knees. So consider how much difference weight loss is going to make. So entirely for the treatment of pathological obesity, not for the sake of vanity.
Dr. Mithal, we have an epidemic of diabetes in our country. We are genetically predisposed to that. Therefore, can this class of medication, not just Ozempic, the others as well, be a game changer in that regard?
Yes, Vishnu, you're right. I mean, the thing is that GLP-1 medicines are not that new as we think. GLP-1 medicines have been around for 20 years. We've been using it for 20 years. The difference that semaglutide and tirzepatide have made is that they cause much more weight loss and are more powerful than earlier medications. So GLP-1 medicines are very important in our treatment of diabetes and related conditions. Now, we are getting stuck on the weight. Actually, as Amrish pointed out, reduction in body fat reduces inflammation to a very substantial degree and reduces risk of many other complications. So let's take an example. When a person with diabetes is treated with the use of GLP-1 analogs like Ozempic, the person has clearly much better glucose control, which reduces all the complications associated with poor glucose control. 2, he or she has a reduction of at least 25% in major adverse cardiac events. Right? He has or she has a significant reduction in progression of renal disease. It's almost therapeutic for fatty liver, as we call it, MASLD. It is important for sleep apnea.
Right.
It's approved. One of the groups is approved for sleep apnea. One of the drugs in the group, sleep apnea also. So the benefits far, far outweigh the risks. And we should not exaggerate the risks. I think personally, especially in media, exaggeration of these risks is preventing people who need the medication from taking it because they are scared. Because of those who, because of vanity, want to take this drug for a couple of kilograms weight loss for a wedding or something, and because they are pushing to use it, others who actually need it for their health have become scared. And to say that so many deaths happen because of these drugs and all is really stretching it a bit. It's not clear at all whether any serious toxicity happens. Of course, there can be side effects. There is no drug developed that does not have side effects. So let's be clear about it. It's not a dangerous drug. Every drug is a drug. It's not candy. It can't be or churran. You buy it off the counter and use it. Use under medical supervision for the right patient. These drugs are a boon to endocrinologists and to patients.
All right, look, I'd like to thank you all very much for joining us. I do suspect this is going to be a revolution in terms of sort of dealing with a lot of ailments which plague so many of us. And I think that the benefits perhaps outweigh the concerns, but we're going to have to wait and see. It is linked to cost. When generics actually do enter, this could be an even more major development in India's fight against diabetes and obesity. And, it's diabetes which is such a primary concern. And obesity is something that we're looking at on this program, not from a lifestyle standpoint, but from a standpoint of a serious medical risk. So Novo Nordisk, that's the Danish company, has launched Ozempic. It's a class of medication called a semaglutide. It comes in the form of an injection. It's not the only one. There are pills as well which are available now. But to manage type 2 diabetes, which is such a killer in India, with the benefit of driving significant weight loss, is something which will save lives. But it's not an easy medicine that you pop and you move away. It is, for starters, an injection. Some of them are pills, but it is important that your doctor treats you. This is not a Crocin or a Disprin that you pop when you feel like it. We leave it there. Thanks very much for being with us.